Washington's Mall. WMAL, where Washington comes to talk.
It is the Saturday Morning Update. I'm Rick Fowler. It's good to have you along with us this morning. And we hear so much about student debt and young people getting out of college. They've invested hundreds of thousands of dollars in some cases in an education, and they can't find a job. Well, it's an interesting conversation, and we are joined by Kevin Lynn. He is the Executive Director of Progressives for Immigration Reform and also the founder of DoctorsWithoutJobs.org. And Kevin, it's great to have you with us this morning.
Rick, thanks so much for having me on. Pleasure to be here speaking to you and your audience.
We've heard about the problem in general, but let's get specific when it comes to the medical field. You have a student goes through undergrad, graduate school, gets out. What's the next step in becoming a doctor?
Well, that's what we created Doctors Without Jobs to ascertain. We realize that there is a problem. Now, most people think you graduate from a good medical school, like Georgetown, for instance, you'll pass your residency, you'll get your license, and you'll practice as a physician. But that's not always the case. Typically, 6% of graduates of U.S. medical schools, these are fine medical colleges here in the United States. I'm not talking, the schools in the Caribbean or Bahamas. They're fine schools, but I'm talking here in the United States that do not get residencies. And the reason this is important, Rick, is if as a doctor you don't get a residency, you will not get a license to practice medicine. Without that license, you can't work as a physician. And right now, about 6%, and that represents a little over 1,000 medical school graduates, do not get residencies.
Now, is this a problem that they're just not the positions available?
Oh, we have an amazing shortage of physicians here. Let's just talk about the macro need. In 2017, the Association of American Medical Colleges did a survey and found that we have a shortage of 21,800 doctors. That shortage is projected to climb to 121,000 by the year 2030. And interesting enough, in the next 3 years, in another survey from last year, 17% of physicians stated they were looking to retire in the next 3 years. So we need these doctors, and the residency positions are available, because one of the big issues, Rick, is there are 1,000 that don't get residencies that graduate from U.S. medical schools, but there are 3,700 foreign-trained physicians that do get residencies at U.S. teaching hospitals.
So we have 1,000 American students who cannot get into a residency program because we have 3,700 foreign-trained medical students who are getting those positions?
Yeah, we're here to ask the question, how is this being done? The big issue is, aside of us needing doctors here in the United States, someone who goes to medical school here in America could probably graduates with about $250,000 of debt. They don't have a plan B. It's not like they can go and get a teaching certificate and teach biology. They have a huge debt to service. And with interest, these things could rise to $300,000, $400,000 if they don't get serviced. There are ways, and we can talk about that later, that things that we should be doing to help these physicians, these doctors that graduate and don't get a residency. But the problem is we are here to investigate why 1,000 U.S. graduates don't, yet 3,700 foreign-trained physicians do. And Americans pay. Those residencies are funded out of tax dollars, out of Medicaid funds.
So I would imagine you have a political minefield you're dealing with, because if you are trying to put American students ahead of foreign-trained students, then you're accused of being anti-immigrant or anti-diversity. But among these American students, do you have African-American students and Hispanic-American students who are not getting these residencies?
Absolutely. If you go to the Doctors Without Jobs website, we do an interview with Dr. Doug Medina. Dr. Medina's father came from El Salvador. As he states there very eloquently, diversity is fine until it works against you. And look at what we're dealing with today. 94% of hospitalists here in this country, that's the doctor, someone goes into an emergency room, probably the first person they're going to see is a hospitalist. 94% are foreign-born. So it's not an issue of the need to bring in more foreign-trained physicians to enhance our diversity. We have diversity. In fact, medical schools have, over the last few decades, made great strides in improving the diversity of the people they accept into medical school programs. The problem is, when it comes time to match for residency and who matches and who doesn't, there is zero transparency. We know only the numbers. We don't know how many women. We don't know how many Hispanics. We don't know how many Black American descendants of slaves. All of this information we do not have.
Clearly, your mission is to take action, correct the problem. How do you address the problem? I mean, it's not one particular entity or group or organization. How do you go about it?
Right, because there are a few governing bodies in here. You have the American Medical Association. Even though today they probably represent about a quarter of the physicians, they're still probably one of the strongest lobbying groups out there. There is also, I mentioned them earlier, the Association of American Medical Colleges. There are the individual medical schools themselves. So there are a lot of folks that have a hand in this. Our job right now is to raise awareness. We want to reach out because right now there's over 10,000 doctors out there that over the last 10 years did not match for residency. We want to find them. We need their stories. And once we have a better understanding of this group, we're going to start proposing changes within the governing bodies.
We have a lot of association people listen to WMAL. We have a lot of people on Capitol Hill listen to WMAL. What would your message be to some of those key players in this discussion?
Well, first and foremost, we have to prioritize American graduates getting residencies. Initially, there's a match. And then for those that don't match, they have what they call the SOAP, the Supplemental Offer Acceptance Program. And this literally kicks in the day of the match, because this is where they try to plug all the holes. Americans should absolutely be prioritized for these positions. That's step number one. The second thing we should be doing, let's say you graduate and you don't get a residency. That college should provide you for a year or two malpractice insurance, because this will allow you then to go work at a clinic. Even though you may not get paid or paid very little, you still have the opportunity to get experience that could help you at next year's match. Other things that can be done, and I've seen this being initiated at the state level as well as the federal government. There's some states that are saying, well, if you have graduated from medical school in good standing, you've passed all 3 steps of your USMLEs, you should be allowed to practice in an underserved area. For instance, let's say a rural area that has a big doctor shortage. Other states like Texas had been looking into funding residencies themselves. And then also we can, at the federal level, we can increase the number of residencies. But if we don't prioritize the hiring of Americans, the making sure that American graduates of American schools get these positions, it's really all for naught.
Well, I'm sure that's something a lot of people listening this morning were unaware of, because I was certainly unaware of it. And if somebody would like to find out more or actually try and help you take some action, how would they go about it?
First, there is the website Doctors Without Jobs. We have a couple surveys people can fill out. Ideally, if you're a graduate and you didn't match, we want to hear you, learn your story. Because what we need to do, ultimately, everything requires a political solution. And to do that, we need constituents out there reaching out to their legislators in Congress, in the Senate, as well as in the state houses. So we're looking to build a movement. So please go to doctorswithoutjobs.org, sign up. You'll be on our newsletter list, and we'll be reaching out because, we want to get your story and we want to involve you and your families in this movement. Because it's, aside from, of course, the graduate that didn't get the residency, it's their family that's invested in an awful lot in their educations, so financially, emotionally. So we want to reach out to that whole body.
Again, that website is doctorswithoutjobs.org. Kevin Lynn is the founder of the organization. Kevin, thanks so much for being with us this morning.
Rick, this was great. Thanks so much.
And again, that's doctorswithoutjobs.org, and the very interesting problem.